Hey everybody, Dr. Eric Balcavage. We're back for another edition of Thyroid Answers Shorts. And today I want to cover this kind of very controversial topic of low T3 and T3 medication. There's a large discussion and lots of controversy around T3 medication. Do patients need it? Do they not need it? And I think it all depends on who you see. And what your goals are and what your symptoms are. And so we're going to break this down today. I'm going to give you kind of what happens in traditional medicine, what's happening in integrative medicine. I'm going to give you my point of view on T3 medication. So as most of you know, the thyroid gland makes two primary hormones, T4 and T3. T4 is the primary hormone that's made. It's kind of the circulating reserve of thyroid hormone. It's not the primary active hormone. The primary active hormone inside your cells is T3. The thyroid gland doesn't make a lot of T3. The thyroid gland makes about 100 micrograms plus or minus of T4 per day, makes about 5 to 10 micrograms of T3 per day. Now, the body in totality makes about 30 plus or minus micrograms of T3 per day. Most of that, given those numbers I just gave you, is not coming from the thyroid gland. Most of it is coming from peripheral tissues, bringing T4 in. That means peripheral tissues, meaning away from the thyroid gland, taking T4, we call free T4, bring it into the cell. The cell then converts that T4 into T3. That T3 can bind to receptors and support metabolism physiology. Depending on somebody's state, what's going on with their physiology, that T4 can also be deactivated into something called reverse T3. Okay. So when somebody let's start with somebody who has hypothyroid signs and symptoms. So if you have hypothyroid signs and symptoms and you go to somebody and they run a TSH and a free T4, you may have a normal TSH, normal free T4, but if that's all that's run, you could have normal TSH, normal free T4, normal total T4 maybe, but still have hypothyroid symptoms. Why? Because what drives hypothyroid symptoms is a low T3 state inside cells and tissues. So if T4 isn't converting well to T3, then you're going to have some hypothyroid signs and symptoms. And if you don't measure total T3, free T3, you would never see it. So if we ask the medical community, the traditional medical community, does somebody need T3 medication if they have low T3? They would probably say no, because they don't even look at total T3 and free T3 on average. Usually what's run is a TSH with reflex to free T4. If TSH is high and free T4 is low, then you may get T4 medication, but they're not typically even considering T3 medication. So I think if you ask 10 out of 10 allopathic physicians, do you need T3 medication if your T3 is low? They probably would say, you don't need it, and why are you running T3 anyway? The only thing you need is TSH. Now, that may be not accurate, but that's their training. That's the guidelines. That's the training. But if you ask the functional medicine or integrative medicine community, they would be probably, if you ask them should patients be on T3 medication, they would probably say, 7 out of 10 would say, yes, patients should be on T3 medication. And I don't think that's truly, it's a great, I think the default shouldn't be, yes, they need to be on T3 medication. I think the question should be, if they have hypothyroidism, glandular hypothyroidism, and we're fully replacing what a healthy thyroid gland would have made in T4, then yes, maybe we should be giving them the 5 or 10 micrograms of T3 that their thyroid gland normally would have made. But if they're taking less T4 than the thyroid gland would normally make, let's say 50 micrograms, should we be giving them T3 medication? I don't know necessarily that we should. And somebody might say, well, what if we look at somebody's labs and their TSH is normal, their T4 is normal, whether it's total T4 or free T4, but their total T3 or free T3 is low. And the patient's symptomatic, should we give them T3? I would say 7 out of 10 clinicians would in integrative functional medicine would say yes. And I would probably say it depends. It would depend on what's the dose they're currently on. They're only on 50 micrograms of T4 and their T4 is normal. Total T4 is normal. TSH is normal. Free T4 is normal, but T3 is low. I probably wouldn't recommend giving them T3. Now, again, it might depend on how low it is. If they were down in the 50s and lab low is like 71, I may be a little bit more concerned that maybe some might be needed because they might have a deiodinase 2 polymorphism that might reduce some of that T4 to T3 conversion. And with the thyroid gland having some damage to it and us giving them some T4, we may lose some of the compensatory T3 production by the thyroid gland. But in general, I would say that the patient probably doesn't need T3. And that's the operative word here. Do you need T3 if your total T3 or free T3 levels are low and you have some symptoms? I would say no. If you have normal TSH, normal T4, normal free T3, whether you're on T4 medication or not, but your total T3 or free T3 or both are low, I would look at that and say, this is probably a reduced conversion issue. This is probably an adaptive response. And in that situation, I probably wouldn't recommend somebody take T3 medication. And it's not because I wouldn't want you to feel better. The reason I wouldn't want you to I would advise against it would be that what are we trying to accomplish? The low total T3 and free T3 is not an indication of an inability to convert T4 to T3. It's not like you woke up one day and your body forgot how to do it. Instead, the reduced conversion of T4 to T3 is the body trying to tell you that, hey, there's a problem here. There's an inflammatory mechanism. There's an infection going on here. So when cells are under stress, there's a reduced conversion of T4 to T3. That's not broken physiology. That's adaptive physiology. So if we've replaced T4 in the system, or you're not even on thyroid medication, your T4 is normal and your free T4 is normal, but you have low T3, low free T3, low total T3, one or of those or both, is the issue really that you just need more? Or is it that your body is trying to downregulate the metabolism? Now, we can go over and look at the reverse T3. If reverse T3 is elevated in that situation, then the body doesn't have a conversion problem. It's not like there's not enough selenium to convert T4 to T3, and that's why T3 is low. Your body actually has enough selenium because it's converting T4 to reverse T3. And it usually converts T4 to reverse T3 because of inflammatory mechanisms. So if the body's adaptive response under inflammation is to reduce the conversion of T4 to T3 to slow down the metabolism and increase the conversion of T4 to reverse T3, why do we think we need to fix that with medication? Okay. And especially, why would we think we would need to optimize that level to that of a healthy person? You may actually be healthy and still have a low total T3 and free T3. If you actually had a viral infection, the healthy response to a viral infection would be to slow down the metabolism, reduce the conversion of T4 to T3. That would be an adaptive response to an infection. That's not bad physiology. You're sick, but you have a healthy response to a viral infection. If there's chronic inflammation in the body, the healthy response, the adaptive healthy response would be to reduce the conversion of T4 to T3. If you're not consuming enough calories and you're calorie restricted or you're starving, what does the body do? It reduces the conversion of T4 to T3 to slow down the metabolism. So I think if your goal is to try and recover your health and your well-being, then when we look at labs and see a low conversion of T4 to T3, or T4 and free T4 are normal, but T3, total T3 and free T3 are low, we need to ask, instead of just giving medication, we need to ask the question, why do we think this is going on? Is this broken physiology, or is this an appropriate response based on what's going on with the individual? And that's where we have to put our doctor caps on and say, okay, what's creating excessive stress for this individual person? And I don't think that that's asked enough. I think what happens too often is somebody says, oh, you're on T4 medication, you're still hypothyroid, your TSH, or your T3, whether they run free or total, I suggest you run them both. But hey, total T3, free T3, they're not in the optimal range. And we're going to give you T3 to make it, to push it into the optimal range. Should you do it? The answer is, I don't know. If you're just looking to chase a lab value and try and optimize a lab value, could you take T3? Sure. It'll make the T3 come up depending on what time you take the medication in response to your lab values. It can change the T3, total T3 lab value. It can change the free T3 lab value. It can change your symptoms. And if you get 5 micrograms, 10 micrograms, and you feel normal, you feel back to a normal state on 5 to 10 micrograms, and you're taking 88 micrograms or 100 micrograms of T4, and you're taking 5 or 10 micrograms of T3, and you feel awesome. And the issue was when you were taking the 100 micrograms of T4, your T3 conversion was a little bit lower, and that 5 to 10 micrograms has moved the needle. You feel good, you function good, you're back to a normal state. You feel like you're out of thyroid purgatory, then fantastic. That's great. You're fully replacing the gland with T4. So you probably need that 5 or 10 micrograms of T3 maybe to optimize you. Not everybody does. Okay. But many times adding T3 when we see a low total or free T3 is a slippery slope. They feel very hypothyroid. They see the low number. We tend to tell them, hey, if we can raise that T3 level with medication, you're going to feel better, right? And sometimes that's accurate. So they get the T3 medication, they feel a little bit better. Their labs improve if we measure them right after they did it, right? 3 hours after they took their medication, and we'd say, oh, things are good. The problem is, if you have some type of cell stress inflammatory mechanism going on, the benefits of that T3 won't last. And after maybe a couple months of taking that 5 micrograms of T3, you're going to plateau again. You're going to be like, oh, man, I just don't feel quite as good as I did before. So maybe we should increase the dose. And your doctor will say, yeah, let's increase the dose. If 5 was good and it lasted for a while, let's give you 10. Let's see how you do on that. And so now you're taking 10 micrograms. And what's going to happen is you're probably going to feel better for a while. And then 1 to 3 months into the process, you're going to probably be like, man, I'm starting to feel tired and fatigued. It's not working as much anymore. And somebody's going to probably say, well, if 5 worked for a while, 10 worked for a while, let's give you 15. And you'll wind up ratcheting this level up. The problem is between the T3 and the T4, if you're taking both, if you're taking T3 only and you had normal TSH and T4 before, as you start ratcheting up the T3 dose, that T3 is going to saturate the pituitary, and that's going to start suppressing TSH. And as the TSH gets suppressed, then you're going to have less thyroid gland production. So what's going to happen is you're going to start losing T4 production. You're going to lose any T3 that was coming from the gland, and you're going to start losing T4 production. So now that 15 micrograms makes you feel better initially, but it's suppressing TSH because it's saturating the pituitary and hypothalamus, especially if there's an inflammatory process going on. TSH is now dropping. Since TSH is dropping, there's less stimulation of the gland to make thyroid hormone. And what else drops? The total T4. And as the total T4 drops, there's less T4 to convert to T3. So now your total T3 drops as well. So now there's less T4 and T3 in circulation, and you start to plateau again. So what does somebody say? Let's give you 20. Let's give you 20 micrograms, right? So now you take the 20 micrograms. You feel better. But with 20 micrograms taken every day, what's going to happen? It's going to saturate the pituitary. It's going to lower TSH, and you're going to start to lose more function of the gland. And in time, there's even less T4 in circulation. And remember, cells bring T3 in to use for a period of time, but a lot of the cells bring T4 in and convert T4 to T3. It's different. How much of that T4 is brought in versus T3 is brought in depends on the cell type. But let's say it's 50% of the T3 inside the cell is from T4 in many cells. And these are kind of generalized numbers. So if there's less T4 in circulation and T3 has a short half-life, as you take your T3 in the morning and then the T3 dose starts to level off, there's not enough T4 in circulation to support those cells. So that's why you start to crash again. And this typically results in people having feeling good initially on T3 medication. And it winds up on many clients that I see being on way too high a level of T3 medication by the time they get to me. And I think it also leads to people being, when we look at T3 and free T3 and say, oh, it's less than optimal and the patient has symptoms and we give medication, I think it leads to inappropriate medication, whether it's Armour, whether it's T3, whether it's a combination of those things. It's generally thought that about 60 to 70% of the people on thyroid medication were put on it inappropriately. And most of that isn't by the allopathic community. It's based on the integrative and functional medicine community making those recommendations. Because as much as we would say that if somebody had high blood pressure isn't the problem, right? We would say the high blood pressure is a sign of a problem. So giving them blood pressure medication doesn't fix the problem. It's the same thing when we look at low T3. If we look at low T3 from a truly functional medicine standpoint, if we see that T4 is normal, free T4 is normal, total T3 or free T3 is low and reverse T3 is high, we shouldn't say, oh, I need to give T3. We should say, why is the T3 low and the reverse T3 high? If the thyroid gland is making enough, why is this reduced conversion occurring? Is the body broken? Well, if the body was broken, like you had a genetic polymorphism that prevented you from doing it, that's something you would have had your whole life. So it probably wouldn't have happened to you in your 30s and 40s. But the body typically doesn't make a lot of mistakes. The primary driver of reduced conversion of T4 to T3 is some type of cell stress going on. That could be lots of emotional stress. That could be relationship stress. That could be financial stress. That could be reduced sleep. That could be poor breathing, especially at night. It could be because of dysbiosis, food reactivity. It could be due to infections, bacterial, viral, fungal. So if the body's adaptive response is to slow the metabolism down of cells that are under threat, and reducing T4 to T3 conversion helps lower the metabolism of the cell, reducing oxidative stress, supporting the defense mechanisms, even though you don't feel well. And we want you to feel better. In most cases, giving you T3 is not going to solve your problem. Just like giving you a blood pressure medication can change your blood pressure, but it doesn't fix the cause of the high blood pressure. Just like if you had a virus and you had a fever, the fever is a good thing. The fever is active to try and help kill the virus, kill the bacteria. Suppressing the fever doesn't support the immune system. It actually kind of works against the immune system and what it's trying to do. So why are we working against the body, especially from a functional medicine perspective? Why are we not just asking better questions and working with the physiology? So when we look at thyroid panels, and if you have hypothyroid signs and symptoms, and you see that your T3 levels are functionally low based on somebody's standards, whether they're my standards, somebody else's standards, T3, free T3, those are low. It doesn't mean you need medication. It doesn't mean you need T3 medication. What it should push you to ask, or what it should push your clinician to ask, is what's causing this? Why is the body adaptively decreasing conversion of T4 to T3? The second thing you need to ask yourself is, what do I want to accomplish? Do I just want a temporary patch to make me feel a little bit better temporarily, because I don't want to make any changes to habits, behaviors, lifestyle? I don't really want to dig into what's causing it. I just want to, it's something to kind of manage my symptoms a bit. Then maybe T3 is the appropriate thing for you. It's not what I typically recommend, but maybe that's appropriate for you. If you see normal T4, but low total T3 and free T3, your clinician should be asking, what's driving it, and how do we figure that piece out? And if you start addressing the why, the real why, the low T3 is not the problem. The low T3 and free T3 is a sign of a problem. When you start addressing the diet, the lifestyle, the habits, the behaviors, you're going to start to find that there's a lot of things that you're doing on a daily basis that are actually contributing to the excessive stress. And that's one of the reasons your T4 to T3 conversion is downregulated to begin with. Maybe you have a chronic gut issue. Maybe you only get 3 hours of quality sleep. Maybe you're in a really terrible relationship and that's creating a big stress response on your physiology. Maybe you're not getting sufficient levels of protein in your diet, and that's causing a downregulation of T4 to T3. Maybe you're overtraining and that you're creating a lot of inflammatory damage to your tissues. And that's one of the reasons your T4 to T3 mechanisms conversion is downregulated. Maybe there's multiple factors here that are creating stress on your physiology and reducing T4 to T3 conversion. Can you take T3 and raise your T3 levels? Absolutely. Can you take T3 medication and feel better, at least temporarily? Absolutely. Are there some people that take small doses of T4 and small doses of T3 and feel awesome? Yes. And if that's the case, that's great. It doesn't bother me. What concerns me is that when you have labs and somebody sees that you have normal T4 and low T3, whether you're on medication or not on medication, that they say your body's broken, you can't convert T4 to T3, therefore the only answer is to give you T3. Or that, hey, we're going to give you this T3 and you're going to feel better. If somebody's going to prescribe T3 medication, they should be letting you know that this is a Band-Aid. It can raise the values. It may make you feel better temporarily. But once we give it to you, the benefit may not last. And there's a point we can give you more, but as we start ratcheting up more, it's going to create more of a glandular problem if you didn't have one already. It's going to start suppressing TSH and create an atrophy issue at the gland. So if you don't want to change diet, lifestyle, habits, behaviors, you're going to be managing lab values and symptoms with medication. But we should, if we're going to provide some thyroid medication and some T3 medication, we have to explain the caveats that go with it. It's not always going to make you feel better. There's a high possibility or probability that as you start ramping up the volume of it, it creates more hyperthyroid type symptoms, more brain fog, more brain fatigue, more anxiousness, more anxiety, more insomnia, more histamine issues. It can start to cause upregulation of your sympathetic nervous system and further decrease your parasympathetic system and create issues. I don't see it being a big issue or a big problem for someone who's on 5 micrograms twice per day, or maybe even 10 micrograms twice per day, if they have no thyroid gland because of radiology, because they've had it damaged due to thyroid cancer or Graves' disease, or they've had their thyroid gland removed. I think those patients, if they're taking T4 medication and they still have a little bit of low T3, yeah, sure, try 5-10 micrograms of T3 twice per day. to kind of replace what a healthy thyroid gland would have made. But once you start getting over that, 10, 15 micrograms of T3, you're working against the physiology. You're giving more than the T3 gland would normally make. And the reason you need more than that to chase symptoms is because there's a cell stress inflammatory mechanism that's adaptively decreasing T4 to T3. And you're on a slippery slope. You may feel good right now, but there's a point where you're probably going to start creating too much upregulation of the sympathetic nervous system, too much T3 into the system artificially. You're going to start suppressing TSH too much, start creating some atrophy of the gland if it's not there already. And at the end of the day, you still haven't addressed the cell stress mechanism. So the dose you take today is going to need to go up and go up and go up. If you add 5 or 10 micrograms of T3 and you feel back to normal, you feel back to your old self and you feel great, and you're never needing to change that dose, like every time you go in, the dose is good, fantastic. I'm happy for you. And maybe it was the right thing. But for a whole host of people that had normal TSH, normal T4, normal free T4, but had hypothyroid symptoms and went to somebody and they said, your T3 or free T3 is low, reverse T3 is high, you need to be on T3. And now we're struggling with chronic hypothyroid symptoms, chronic hyperthyroid symptoms. They can't find the right dose of T4, T3. You probably started down that slippery slope with a little bit of NP thyroid or T3 medication. And you're on that roller coaster ride of now suppressing the gland. And now the gland's not making enough hormones. And now you need more. And you're still not using T4 to T3 appropriately at the cells because of that cell stress response. So I think if your goal is to recover your thyroid physiology, then instead of trying to fix a low total T3 or free T3 with T3 medication, you got to start asking a better question, which is, why is my body adaptively not converting T4 to T3? What's causing that? How do I fix that? You do that, T3 will fix itself. The body will start converting T4 to T3. You won't have to manipulate it into a lab reference range. You'll get off this kind of merry-go-round or roller coaster ride of upping and downing the dose of T4 and T3 or T3 only medication. If your goal is just to manage a lab value, yeah, you'll be constantly doing it with T4 and T3 medication and playing with the T3 dose, trying to find the dose that's appropriate, but that dose is always probably going to change based on what's going on in the stress in your life. So I know I'm rambling on here a little bit, but I want to make sure I covered this topic. So to summarize, if you have normal T4, normal total T04, low normal free T4, and your T3 is low, your free T3 is low, and you have hypothyroid signs and symptoms, do you need to be on T3? You do not need to be on T3. If your goal is to recover your thyroid physiology, then start asking the question, why is my body not adaptively converting T4 to T3? If you aren't willing to ask those questions or don't want to ask those questions and you're just looking for a temporary fix, sure, you can start on some T3 medication that'll raise the lab value and maybe change your symptoms. But be careful. It's a slippery slope. You haven't addressed the root cause of the problem, which is something triggering low-grade chronic inflammation, which is adaptively reducing the conversion of T4 to T3. The T3 may work for a short period of time, but as you start to ratchet the dose up, because the benefits probably won't last, as you start to ratchet it up, you increase the risk of a number of different issues going on. And in an effort to manage some symptoms, you're probably going to create a whole bunch of new ones. So I hope this information has been helpful. If you have any questions, you can email me at info@drericbalcavage.com. If you have an interest in learning more about your labs and what's possible and maybe my approach to thyroid physiology, you can DM me discovery, and my team will send you a link to schedule a complimentary discovery call. So I hope this helps. If you have a question or a topic that you'd like covered on the Thyroid Answers podcast, yeah, send it to me. Send it to my email, DM me. Hey, here's what I'd like to hear discussed on either the long form version or the Thyroid Shorts version, and we'll try and get it covered. All right. Take care, everybody.